I'm Natalie Hall, I'm the Science and Safety Team Manager.
And I'm Caroline Johnson, I'm the Science and Safety Practice Development Social Worker.
It is a practice model that works with children, young people, their families, and it's all about looking at strength-based. So yes, we acknowledge that there's worries, that's why we're involved, but it's all about finding those strengths, building relationships, working with people, not doing to them, and making sure they create their own safety plans and having people around to be able to do that. I think that when you tell people what to do, they do it for a certain amount of time and then things start to unravel a little bit, and you see that quite often, and that's because it's not something that they've created, it's not their plan, it might not feel normal to them, and working with people gets better buy-in. We really focus on relationships.
Relationships are key to the model, so it's about building relationships, really listening to people and their experiences, being really curious. It's about a questioning approach, not asking lots of strength-based, solution-focused questions to really draw out the times in their lives when things have gone really well, good things about how parents and the wider network really care for these children and young people, and then building on that to think about, you know, what are the future safety plans going to look like. But again, it's about moving away from that, what may have been a previous approach where we'd go out and be quite oppressive with families, and families have fed that back to us, that they didn't like the oppressive approach, they felt like they were just told what to do. Children and families tell us now that they feel more listened to in this way, and they have much more participation in the plans that we develop with them.
And a lot of the way that we do that when we're building relationships is through like the language that we use, like Caroline said, the questions that we ask, you know, making sure that they understand all of the things that we are doing about our work and our involvement, because it's about their lives and it's about making sure that they're really clued up about that.
Yeah, the language is so important. We use our professional jargon, we use lots of acronyms that it just feels very alien to them. So it has to be about closing that gap. This is about their lives. So we have to talk and use language in a way that, you know, is clear and everyone understands.